Chitra, let's start the session.
Chitra, you are in mute mode.
Brilliant morning, everyone. Very warm welcome to today's webinar. So, AI is at the heart of digital transformation today. But its true power is unlocked when cutting edge knowledge and innovation meet real world execution. That's exactly what our discussion will be. We will dive in today. So, industry academia collaboration for effective implementation of AI strategies in organization. So, gentlemen, welcome you all. This is Chitra from Gravitas AI, and I will be your host and moderator for this session. And I'm very happy. A warm welcome to you all today. So, we're gathered today to explore how meaningful collaboration between industry leaders, academic institutions, and solution providers can turn AI from a buzzword into real measurable impact, especially in critical sectors like healthcare, medical technology, finance, business operations, etc. And we have our panel brings together exceptional minds, senior leaders from healthcare like hospitals, medical devices sector, etc., and educational institution and AI tech company. So together they will share their real world experiences, challenges, and what's working on the ground. So, viewers, here we are with another episode from Gravitas AI for you all. I encourage everyone listening in. You can drop your questions in the chat, in the comments, etc., and we will get back to you with the answers. With that, I would like to introduce all our panelists, and I take privilege on that. First off, we have Mr. Neeraj Lal, the Regional Director of Medicover Hospital. He has rich expertise in operational excellence, business development, strategy, quality, and whatnot. He is an honorable member of various hospital administration and healthcare associations. He's also a board of advisory to many institutions like IIM. Sir, can you wave for the audience just to identify?
Hello,
Thank
very
you so
good morning
much.
to all.
Thank you so much, sir. And with that, I would like to introduce our second panelist, Dr. Rajiv Chhibber, Vice President, External Affairs of
Morning, everyone.
Sahajanand. Yes, sir. Sahajanand Medical Technologies. And he has volunteered in multiple organizations as a mentor and as an advisor for media and external affairs, supporting environmental issues, blood donation, startups, and I could go on and on. Thank you for joining today, sir. We are very proud to have you today. And with
Looking
that,
forward.
I would, yes, sir, thank you. I would like to introduce our third panelist, Professor Dr. Arunava Bandyopadhyay, Assistant Professor of Finance in IMI Kolkata, who has both academic and corporate background. And he has shared his knowledge and research in many prestigious international conferences. Hello, sir. Thank you for joining today.
Good morning,
And
everyone.
good morning. And lastly, we have our own Mr. Mukesh Sinha, the co-founder of Gravitas AI. Hello, sir. And
Hello.
to, to tell about him, he is an accomplished leader and entrepreneur with nearly 3 decades of experience in healthcare and health tech ecosystem. So I'm so glad to share the forum with all the great minds today. I'm looking forward to an insightful session. So shall we get started?
Yes,
Yeah.
please go ahead.
Thank you. Great. So let me shoot my first question. Before that, I would also like to remind the topic that we're going to discuss today is industry academia collaboration for effective implementation of AI strategies in organization. So with that, let me shoot my first question. My first question would be to Mr. Neeraj. So, what is the importance of adopting digitalization for practice management? I mean, is the implementation a part of your digital transformation map or it's a separate initiative altogether? What do you think?
All right. Thank you. I think this is the most top question in the healthcare. So, Medicover is a European-based company. which is based in four states: Andhra, Telangana, Maharashtra, as well as Karnataka. So we were the first hospital in the country to be 100% digitized. So we don't have medical records, we don't have medical record files which is available on the floors. Our patient walk in to the OPDs and just walk out. So if you see our staff nurses, they are having tablets and iPads. So they don't have medical records where they write so many medical things on the file. So we have a total control of our clinical operation, and which is supported by Medicover Super app. So now I am sitting here in Pune for some meeting, and I have approved three purchase order. I've approved 10 indents, and I can see the business of my six units, which is available in Maharashtra as well as Karnataka. So that is the importance of digitization of healthcare, and we are implementing this in our practice management. Say, for example, our all the booking, it is like book my show. So all our patient is booking the OPD consultation depending upon the slots of the doctors. So I can predict today, as per slot available with the doctors, how many appointment has been booked, how many leads has been generated, how many it is converted into a consultation, so that the doctors who are busy in shunting between the OPDs, IPDs, and the OR, they get to know they should be available where. So I can also predict, like during Saturdays, Mumbai, Pune, as well as Bangalore, our health checkup is maximum. So I can also allocate the staff according, with the help of a AI tool, accordingly, because it has to be uniform across to take the load of these things. I can also see the no shows and gaps in the care also because of the digitization. And lastly, data driven decision. I have seen, I'm in the healthcare for the last 2 decades. I've seen most of the decision taken by the experienced person, but it is not by data driven decision. So I think that is more important if we use AI into the healthcare practices. Say, for example, each and every X-ray has to pass through a radiologist. So, say for example, I am doing today 250 health checkups in Bangalore and around 342 in Mumbai. It is practically very difficult for a radiologist, three radiologists sitting, to take care of a health checkup patient who is coming. Number one, taking care of the OPD patient as well as the IPD patient. So, what we have done, so our X-rays pass through a AI tool. So all the normal X-ray pass through that, and all the abnormal one goes to a radiologist, and it get it done. So I think that is more important, and of course at the end of the day it improve revenue cycle also. So I think digitization in healthcare is a way. If any hospital who's not using these AI tools in the practice, I think that hospital will gradually fade down. And these days now healthcare is coming out of the hospitals, so you don't find healthcare in the hospital. Like we have a patient engagement model. Once the patient leaves, right? So whenever this patient is leaving, the hospital is in direct engagement with the patient in the form of a, say for example, the medicine is being given to the patient for a week. Fifth day a call is gone, depending on the tool. A customer care of our hospital call to the patient, your medicine is getting emptied, we'll be sending the medicine again. Any home healthcare visits, everything can be done through this mechanism. So I think adopting digitization in the practice makes a difference. You have a control over business, you have a control all the clinical decision and the business decision you to take, you have a full control over it. At the end of the day, patient experience is one of the best. So these are the
That's
few input which is happening in my hospital. Therefore, I can say with confidence.
Yes, yes. Thank you so much for explaining clearly on where and all you've been currently using and how important it is. Actually, that brings me with more questions, but I would like to focus on one point at this point of time. You mentioned about using the AI digitalization in radiology and equipments also, which leads me nicely to the next question to Dr. Rajiv. So, how does AI factor into your product development strategy in SMT?
So, Dr. Lal just gave a very great example on how the entire patient care continuum, as well as hospital management through AI, can actually be done. And as service providers to hospitals, or as product providers to hospitals, their leverage is also our encashment in that sense. When they look at how AI is enabled with regards to patients, with regards to the availability of products, availability of services. So that's how we also get into the entire service sector where we are providing those products and services to the hospitals. But the larger question is how to adopt digitalization into healthcare. So, from a corporate perspective, we are doing a lot of initiatives. We are doing, logistical compliances with regards to AI. Where do I need to have my supply chains focused? Which are the disease dynamic areas where there could be a possibility of having my products in those hospitals? And what could be the possibility of even utilizing AI in product development in advancement? Because we're talking about an era where everything is going to lead towards digitalization. AI is just a part of the entire digitalization. We're talking about an era where digitalization is going to aid the triple A's, which is the affordability, availability, and accessibility of healthcare. And when I say aid, it is not aiding in terms of real-time aid, but that aid is AID, which is advancements in innovation and digitalization. If we do not have that aid to healthcare, I think the entire stream, right from manufacturers to hospitals to service providers to even the patient care, this will really get jeopardized. And we don't want that kind of a system happening where, we don't have access to quality healthcare just because we have not digitally grown. We see the challenges of today. I mean, there are rising costs, there is unequal access to healthcare. There are poor outcomes in most cases when we look at it, and then there is a growing burden of chronic as well as diseases which are otherwise growing because of lifestyles. So there is a collective demand that requires action, and that action requires digitalization. And under digitalization, the biggest tool that we have is making it AI or making it enabled so that digital access could be considered as a digital health revolution that requires more than technology breakthrough. It requires effective collaboration and system level alignment. What Dr. Lal talked about and what I provide is a real time system level alignment where hospitals have that entire data. They would demand a product and they will look at how the patient centricity through various digitalized elements can actually be given to the last mile connectivity. So that's something very, very important. And we kind of like understand this from a very superficial perspective right now. But the effectiveness of AI in healthcare, it depends on strong interconnectivity across diverse sources. These are data sources. This enables scalability, trustworthiness, equitable algorithms. What Mukesh ji normally talks about when he speaks on various forums. We talk about these algorithms that need to be really deciphered and changed. There are so many digital platforms and tools across countries, across a lot of service providers, and that is actually addressing the entire quantum of universal health care. So I think to a large extent, when I talk about AI, AI means collaboration. AI means looking at interconnectivity. And another AI that I would want, and we fortunately have an academic institution here, is academia and industry approach. Because the biggest defeat is when we have AI and we do not have human resources or professionals to really take and leverage that AI to the society. So if we don't have those kind of leverages, those kind of interconnectivities, those kind of collaborations in the entire ecosystem, I think we're not talking about something which is a digital public health vision that we're really talking about, especially when we have Ayushman Bharat and Ayushman Bharat Digital Health Mission.
Yes, yes, that's a great insight to put across, and we heard from both of their perspective, Mr. Neeraj and Dr. Rajiv's perspective. So, which actually moves me to the next question to Mr. Mukesh. Sir, you have played a vital role in developing AI solution for healthcare in Gravitas AI. So, do you see AI taking a more active role in diagnostics or even clinical decision making in this future? We heard the perspective of both of them. What is your take on this? Because you have experience from both healthcare and from the tech company. So, what is your take on this?
Yeah, I think it's a great question, Chitra. In the diagnostic, and I'm agree here, Mr. Neeraj and Dr. Uh, Rajiv would be agreed
Rajiv.
that it is being used for the quite long times in the hospital. Earlier, like we are saying, software, like software version 1, software version 2, many of these technologies were available. But of late, particularly for last 1 decade, we are talking about like AI tracker or AI enable equipments are there. So right from any kind of equipment, just example for like in ophthalmology, there are so many equipment, particularly laser machine or even to diagnostic for the retina and other things. A lot of research is being done. I say AI enabled tool that scan the your retina and give the early kind of sign that okay, this particular this person is going to develop the diabetic retinopathy, or even so called even the early detection of the cancer, some sign is also coming up. So it is being used, but now it's with data driven. Now people are more conscious, and so that the result are very very visible. And so it is going to be more and more. So all the equipment which is not AI driven, I'm sure it is over a period of time that is going to be absolute. And Dr. Neeraj has mentioned in one live cases that okay, how even not only the diagnostic day-to-day operation of the healthcare, number of patient, resources, everything is now linked with the data. And when you talk about data, the AI is nothing but it is a outcome or very robust outcome of the data management. So that can give you the exact what is happening now and what is going to be happen in the coming days. And based on that, all the product diagnostic equipments, X-ray machine, CT scan are being developed.
Great, great. Thank you so much for that collective understanding, Mr. Mukesh. So let's hear it from the academic perspective. Professor Arunava, my next question is to you. So, how IMI, as a premium academic institute for professional, contributing in development of AI revolution in India?
Thank you for the asking the question, and it was nice hearing from the industry about the applications of AI that is going on and how it is getting more and more developed every day. So,
Yes.
talking about IMI, so IMI has been established as the as a first corporate sponsored, I think, the school in 1981. So, IMI Delhi was established in 2010-11. IMI Kolkata, and then IMI Bhubaneswar. So we have three campuses that got established. And being part of a corporate, we are not always a purely academic institute. We always had that industry connect with so many of group companies and even hospitals featuring in that group. So what we I think is AI revolution is not only changing the healthcare sector, it is having impact in all the sectors. And as other speakers was talking about the real world applications of AI, right? So there is a huge skill gap that is happening. I think everyone would agree that the demand is huge. The fast pace of AI adoption that is going on in industry, we will have a huge skill gap in the upcoming years because of everyone is trained on basic skills and other things, but AI in itself requires a lots of skill implementation, requires a lots of mindset change. So only a professional can be part of that digital transformation journey if they are trained in those aspects. And in IMI we are totally focusing on that, and that's why we have taken up this initiative of thought leadership in digital transformation. So we are trying to focus on having a digital transformation mindset in every sector, and we are focusing more on those courses that are tech driven. So like fintech course, then we have AI strategies and digital transformation for business. So we are trying to club the business skill set and mindset with the upcoming things in the AI domain, and then implement those in our training. So at IMI, we not only teach our PGDM, that is the core MBA course that we have, that to our students, as well as we have different executive programs, and we are also designing. So AI without industry is not at all possible, and that's why we need the industry support as well. And we are co-developing courses with the industry, and we are partnering with different industries, so that our students are also working in with those teams, and they are trying to develop those kind of different applications, or trying to face the challenges that the real world businesses are facing. So at IMI, I would say that in the professional world, we are trying to reduce that skill gap, so that the people that are getting trained or getting certified by IMI, they are trained and well knowledgeable to participate in the digital revolution, right? Digital transformation journey of any sector that is there. And healthcare is the most demanding sector right now, I would say. And this is the sector that is going to contribute directly to the society, right? So the more healthcare is being adopted in the different healthcare facilities, right? AI is being adopted in different healthcare facilities. It can help actually the society in various ways. So I think most common thing is the financials, right? So there is almost around 47% of the out of pocket expenses are there in India, when in the healthcare system, and we know only 3 to 5% of the GDP is being spent on the healthcare expenses. So it is time that means already private players are participating, and they are actually creating better and more efficient operational facilities. And more important is the customer engagement that sir already spoke about, that how, because customer satisfaction and engagement is the very crucial place where AI and other technologies can actually help, right? So I think at IMI, we are trying to reduce that skill gap, and then feature in with our all kind of certification courses and other things that we are co-developing with the industry. And Gravitas AI and other are our very close partners in this domain, where we are trying to uh, develop and contribute back to the society through
Great,
knowledge.
great. That is exactly why we are here today discussing about this particular topic, bringing in all the minds from industry, from the tech company, from the academic sector, to make the students tech ready and industry ready to make a change in the future, and make an AI revolution successful. So that's exactly why we are discussing about this topic, and we will be discussing more on this. Before that, I want to address challenges right now. So we talked about our perspectives and how it is implemented now and how we are looking at the future, etc. But let's talk about these challenges. Let me ask this question to Mr. Neeraj. So what do you think? What are the biggest challenges in implementing AI solutions, especially in Medicover hospitals chain?
2 years back, we have implemented Tech Pro as well as a Medical Super App. So many challenges were there. Four more challenges is the consultants, because you have a two level of consultant. One is a star consultants, and one is a consultant who are youngsters who are known for this technology. Say, for example, we have started a orthopedic robotic system. We have taken a Da Vinci robotic system. So we have two category of consultant. One consultant who have been trained in this technology, and they use this AI technology in the betterment of patient care for using robotic. And there's certain other consultant who are very senior consultant who are very good, but they refuse to accept the technology, right? So there is a shift from patients from one doctor to another doctor, because he's giving an option. Say, for example, a conventional cardiac surgery, CABG, to a minimum invasive cardiac surgery. If you see, most of the senior cardiac surgeons are not doing a minimum invasive cardiac surgery, because in cardiac surgery you have to actually open the breastbone and do this. So after surgery, there is all stitches around in your chest. Vis-a-vis minimum invasive cardiac surgery. Similarly, in orthopedic joints only. The most important challenge is what? Adoption of these technologies by doctors. So there the role of healthcare ecosystem in the term of support, the IT people, the support in the term of physician assistant has to be given. So the limited clinical adoption and trust. Then second challenge is what we have seen: data fragmentation across all the system. If you see in healthcare, if you ask your student to visit any of the hospital, so there's so many things which is happening in the hospital, and data is not talking to each other. Like always, hospital got lab management system one, PAX is one more vendor who's making, EMR is one more vendor. So
Yeah.
different hospital units are having a different EMR, so making it hard to unified AI models. So second is this. Now third challenge is what we have seen is a cost. So integration of connecting system like PACS, lab information management system, and making a super app like Medicover super app, which I was talking about. But at the same time, you have a challenge from data privacy also across the world. And India, people are talking about this. But thankfully, after 1.5 years of work, now we are 100% client. Like I was a part of Apollo Hospital where the EMR is just 42 percentage. So I've been working in other hospital also, but here thankfully, our records are 100% compliance. So we are having e-records for each and everything, and you can control. So I'm talking to my team now, not I'm talking to that in the form of a KPIs: how many leads for the day, how many appointment has been given, and how many actual consultation has been given. I can also track how many nursing call management system has been responded by my maintenance team, by housekeeping team, by FNB team, as well as a medical officer. If there is a poor nurse is there, she has to go to the room almost every time. So we have reduced the nursing work. 33 percentage of the nursing is used for the skill part of it. So I feel, challenges are there, but I think if we got a vision very much clear, we want to have it. Like one fine day in Medicover, all the OPD prescription was removed, paper prescription were removed. So I think it has to be pushed from the top. You have to have team leaders, you have to be have ambassadors in the hospital in the form of doctors who can participate in this process. And of course, we should have students, and we have a staff who use this technology for the patient. And at the same time, the adoption of this technology happened very smooth. So I think these are the few challenges which we have seen over the past few years, but thankfully now, it is all controlled. You can take your decision based on these things. Like in the morning, I was talking to a Bangalore team. 150 sonographies has been planned, but because of this placement of the doctors as well as staff is not there. So AI tool is giving these kind of thing prediction, on Saturday these many appointments are coming. So I think it is happening now. And our review is not happening through a PowerPoint presentation. We directly log on to our super app and see what Bangalore is doing, what Mumbai is doing, what Pune is doing, and so on. So I think it is helpful now, but of course the challenges, as I mentioned earlier, was there.
Yeah, that is so great, and thanks for sharing the challenges you've faced. But I think I know whom should we lead the next question to. I would like to ask this question to Mr. Mukesh. So he mentioned about Mr. Neeraj mentioned about the challenges he has faced and how they have addressed. I'm sure that there are more challenges still not being addressed in many hospitals who are not practicing the AI in their practice management for their hospitals, etc. So, from your experience and being playing a major role in the healthcare sector and developing AI solution for healthcare sector, Mr. Mukesh, what are major challenges in healthcare that are being addressed by AI, Gravitas AI solution? Can you share it with us? So you're on mute.
Uh, Mr. Mukesh, you're
Maybe
on the mute.
sorry. So everybody is aware in India demand versus supply. In other way, number of doctors versus the huge patient is always a big challenge. So ratio is really a big problem as well as an opportunities. opportunity in terms of the technology, because you wanted to connect with the patient, and you have a very limited staff, even there is a staff but may not be trained properly. So here the role of technology, particularly AI based, like in Gravitas we are working in the area of conversational AI, that provide you digital assistant kind of thing. There it is assistant for the doctors, it can be assistant for the patient. So it's a connect the bridge between the doctors and patient, hospitals and patient. So it's a 24 into 7, patient can ask the basic questions, information about the hospitals, faculties, all this information in their own language. Because these days a language chatbot or virtual assistant are available. So you able to know, Mr. Neeraj has just talked about like leads and other thing. Many times hospital try to connect to the hospitals at the odd times, and either customer care department or front desk staff is not there, but all the leads can be captured through the chatbot, right? So chatbot can collect the information, can book the appointment depend upon the doctor availability, and of course you can interconnect with the whatever the EMR you are using. There is a possibility to connect with the EMR. So you know how many patient coming through the online appointment, how many patient is coming through the direct on a spot, and then you have a complete data. And based on the data, you have heard about all the speakers. You can predict about the futures, ki how the patient flow would be there, which department is performing better, and based on that you can complete plan for your budget for the coming year, which area need to be focused more, which area need to be addressed. Even the geographic area, patient coming from which geography, that can be also addressed with such kind of conversational AI. And there are other digitalization is also, but we are more focused on the digital conversational AI. So definitely future is quite bright. And adoption rate, because patient is also understanding, and deep penetration of internet, that is blessing in disguise, I would say. And it is that too, it is quite affordable also. So it is a great technology and human skill are merging together. So future is quite bright. And in fact now we are talking about digital hospital also. So you can get many of the things, unless until you required a physical intervention or touch of the patient. Rest other thing you can do it through the equipment and the technology based solution.
Yes, yes. There are more actually challenges. In fact, you talked about the patient waiting time, multiple language options, etc. The patient waiting time has been drastically introduced, is what I heard using many of Gravitas AI solution, actually, which is one of a major factor that are considered in NABH. The patient waiting, reducing the patient waiting time in the hospital lobby is one of a major factor which are addressed when the patient are able to directly get in touch with the hospital through this kind of conversational AI. So thank you so much, Mr. Mukesh, for
I
sharing some
just
of.
would like one more,
Yes, please,
because
please.
patient satisfaction play very important role. So in fact,
Absolutely.
the bot can help you to enhance your digital, like more Google positive feedback and all these things. So practice management, definitely it is helping in much better way through the technology.
Yes, yes, great. Dr. Rajiv, I have next question for you. So, Mr. Neeraj has spoken about the minimally invasive, the devices and how AI, plays a role there. So, SMT manufacturers, minimally invasive heart devices, high-end cardiovascular, endovascular heart devices, etc. There are more. So, what are some key AI-powered features you have integrated into your devices?
So I don't think it's real time AI features that are integrated into a device, because your health data is your empowered device. You know. Mark sheet, basically. That's how I
Yes.
could say it. See, when we talk about, when Dr. Neeraj talked about minimal invasive devices, he largely talked about how surgeries have now become something from which were earlier cheap far to now, just a simple procedure which does not require too much of patient agony, pain, as well as it is predictable also. So when we talk about having our implants, I think we talk about the predictability of the particular product being in the well-being of that particular patient. So for instance, we understand that to go into a to basically do a open heart surgery, one requires to cut open the rib cage, one requires to do the surgery at a beating heart, and there are certain challenges towards the patient. The patient is an old age patient, because at that point of time in the early 70s, that's where they normally go into all of this. Whereas if a technology that has been developed, which is minimally invasive, it gives them not only the comfort of not having that pain and agony, but also the comfort of staying less in the hospital, recuperating at home, having a direct interactive session with the surgeon concerned, the cardiovascular or interventional cardiologist concerned. So those are things, and that becomes the data that we kind of like rely upon, because then there is the entire algorithms that we follow, where we look at the patient history, where we follow the patient for the next couple of years to look at what changes could be done in terms of the product, what innovation can be done in terms of having more ease of living when we talk about it. So I think it's a entire portfolio that needs to be dovetailed into the ecosystem. The ecosystem, right, starts from the manufacturing of the product to leveraging the data that the product can actually give you, and to look at how ease of living can be ultimately given to the patient through the caregiver, which is the hospital or the doctors. So it's something that needs to be tapped constantly, and I think when we talk about India, we are developing, I think, one of the best uh, digital public health infrastructures that we have. India is a living example of a thriving digital health ecosystem itself, right? Whether it is the Ayushman Bharat Digital Health Mission, where we now have a unified digital health ecosystem with ABHA records for integrated digital health, patient records that we're looking at, with bridging gaps amongst diverse stakeholders through digital pathways. We have the, through the COVID and the ABHA app, we are looking at re-looked at. Today, if you look at the COVID app itself, India provided more than 4 billion doses to not only within India but also outside India itself. So, we are setting global benchmarks to large-scale health system digitalizations. The eSanjeevani portal that works around, it facilitates, I think, billions of consultations every month itself, and we're connecting people from the remote areas to quality healthcare, and demonstrating how a simple thing like telemedicine has the potential to bridge care disparities. So I think the larger thing is that how can we develop, or how can we transform healthcare delivery across the globe, across areas which are not reachable in that sense, and address the critical challenges of expanding the access to healthcare through AI powered diagnostics, through bridging these gaps by specialist care therapies, as Dr. Neeraj just mentioned about, or even remotely serving the underserved regions. So I think this is a big example. And I was at the World Economic Forum last year. The World Economic Forum genuinely hailed, the government of India's efforts around it. They talked about how the northeastern sector is actually using digital healthcare towards its advantage because of the tough terrains there, and the progress in various diseases. Whether it is cardiac diseases or cancer care, or you're talking about now lifestyle diseases that people have started to look at. So I think these platforms are overcoming geographical barriers and reaching populations with high quality healthcare.
Yes, yes, yes. Thank you. Actually, I must thank you that having shared a lot of intricate details and broader information. It's very insightful and informative. Thank you so much. And that leads me to the next question to Mr. Neeraj. I'm going to circle back my question to Mr. Neeraj again. So we heard both of them talking about the patient, satisfaction, and how directly it affects, it benefits the patients. So you earlier told about the challenges faced in your practices, and how you're overcoming with the support of AI. But I would like to know this particular thing. Have you seen any improvements in patient outcomes apart from operational efficiency? Do you have any specific stories or studies that you would like to share to us today?
No, I think you are right. Patient. So we measure the patient satisfaction through this clinical output. No, AI
Okay.
tool predict like sepsis risk in the ICU patient 6 hours before the clinical signs. Like say for example, I got around 85 ICU beds, but we are managing around 5,000 ICU beds through a AI dashboard. So like small tier two and tier three cities, they got ICUs, but those ICUs are not capable of having a good equipments as well as a critical care specialist. So our main ICU is a working station for all those ICUs, and their continuously data is flowing from these ICU to our main ICUs, where the doctors which is sitting in our hospitals, various multi-specialty consultant, including the critical care consultant, they can predict all these things. So whenever like something, there is something known as code blue in the hospitals. So they, through the AI tools, including machine learning and all, so these data flow into our system, and these doctor help the doctor sitting in those ICUs to take a call at an appropriate time. So this is very, very beneficial in order to support the clinical data. I was also talking about, like most of the satisfaction in the hospital is seen when the patient is waiting in the queue, doctors are not there, the staff is not there. So like AI also forecast, the OPD footfall spikes. Like you are expecting 30% more patients in the long weekend, so staffing has to be adjusted accordingly. So it helped us there also. So therefore I was talking about in cities like Pune and Bangalore, the number two. Plus personalized patient engagement, like say for example, we got one small tool, like in the night 8 p.m. to 8 a.m., how many patient visited our ER. So there are some of the patient which is converted into from ER to the IPD. There are certain patient who comes to the ER, they see a doctors, they give some medication and go, and there's certain patient who goes discharge against medical advice. So in the morning you got a report, these many patient attended your ER, and these many patient converted, and these many patient you need to follow up. So a follow-up call goes from the hospital to these patients, and they say, you visited our Medicover ER yesterday night at 2 a.m. for this problem. I'm sure you're fine now. If you're not okay, you require a second consultation, we can book you for a virtual consultation, or we send a vehicle for you. And patient feels so happy. My spouse is not asking me, my friends are not asking me. In the night I went there and they're calling us. So really it helps them. And I have seen, every day 2 to 3 patients come back to the hospital for the admission, and some require a second consultation. So I think patient engagements and patient satisfaction with help of these tools help us in a better way, right? I always say, you forgot the birthdays of your family friends member in this fast paced life, but I think all the social media application, maybe a Facebook or LinkedIn or anything, they get to know so and so got a birthday, and you feel very good, somebody's calling you and saying to you happy birthday. So we are using all those things in our ER, in our OPD and all. Patient get discharged from the hospital, he got a phone call after 48 hours. So it makes a difference. So I think we are making use of these tool in order to improve our patient satisfaction, and we say to the patient, wherever you are, we are engaging with you and we are taking full care of you.
Wow, that's definitely a game-changing story, and I wish more healthcare sector adopt this and make it very easier for the patient, because that end of the day, that's where it all pays the um, result. And thanks for sharing that story. That's worth sharing, and it's definitely a game changer. So I would like to ask Mr. Mukesh my next question. So, sir, how would you like to add on, give us an information about this particular collaboration? I mean, the Gravitas AI and IMI's collaboration, how it is going to help in India's AI mission, particularly in healthcare. You've heard the game-changing stories from Mr. Neeraj and how in the medical equipment technologies and medical equipment manufacturing companies are adopting AI, and the game-changing solution that we can expect in the future. So, in order to achieve that, and also to make the student ready for the industry, so that is exactly why we are collaborating. So, can you tell us how this collaboration is going to help India's AI mission, especially in the healthcare sector?
Yeah, before I'll answer this question, I'll just add to what Mr. Neeraj has mentioned.
Please.
Earlier, patient get engaged with the hospital only during the procedure, whether it is OPD and IPD. Now it's a 360-degree pre OPD and post discharge, right? Somewhere you will get connected, or not only during the connection, maybe post follow up. So whether it is 3 months, 6 months, an year, or something is happening in the hospital, new equipment, you are getting the message or webinar. All these things are getting there. So really, patient feel that okay, 365 days 24 into 7 there are somebody to take care, and thanks to the technology, because doctor hospital business is very skill driven. Doctor has very limited times, and he need to take care of many patients. So technology is really enabling to the doctor as well as the patient in equal way. Coming back to the question about academic or industry collaboration, these are the two sector I truly feel where technology helping a lot to create a big impact in the society, because healthcare is one of the issue which required anybody and everybody, whether you are healthy or unhealthy, you require at certain stage of your life. Similarly, education, it is very important. So two very important sector working mostly in silos. Over a period of times, now we do understand the strength of each other, and then we are trying to collaborate, because when these two big minds come together for the common cause, right? Because same thing is being taught in the university, but most of the things are theoretical, and these they little bit have incubation center, but actual solutions are not coming because industry or academia they are working separately. But such kind of approach, we are wanted to make the things from the laboratory to the actual real world, right? So practical things are only you will be able to access when you have a industry collaboration, and industry want a newer and newer innovation. So that again it goes back to the researcher, student, R&D teams. So these are going to help each other, and it's not only individual institute and individual organization, because it's helping the entire industry. And mind it, we are making the student who are the users, either they are the student or the early stage of their professional career, right? So you are making these people's even the future ready also. So this is a very powerful, I think, collaboration. I would like to thanks at this platform to IMA again coming forward and collaborating with this. So Gravitas AI is one of the example. I'm sure this will cascade to the other institution also. And second, as for AI mission is concerned, when you are collaborating, so you are giving access to the larger society. So you are democratizing the technology to the large masses. So that is another very, and that makes basically your healthcare or even education is very cost effective. So this is a very important step, and it's a welcoming that. And once again, I'll thank to the IMI for the such kind of collaboration.
Yes, and we are all excited on the game-changing solutions that you're going to bring, and expecting good for the future. Professor Dr. Arnava, what is your take on this? Would you like to add on to that?
Yeah, sure. So it was nice. First of all, listening about the challenges, then the solutions, and then about the collaboration and all, right. And business. So we are into business education, and business is all about solving challenges. And as Mr. Mukesh already mentioned, we were earlier all business schools were solving these challenges on the theoretical front, and now we are collaborating to face the real world challenges, right? So how to solve the real world challenges in the industry, what the industry is facing. And one thing that strikes in this approach is the every challenge that Mr. Neeraj has already mentioned, they are actually, each and every challenge is actually a new business domain in itself. And there can be many startups featuring in those domains, which can actually contribute in the overall like healthcare ecosystem, right? So we are trying to make the healthcare, so healthcare professionals are, they are expert in their own domain, but they have to be aware of the technological innovations, and they have to be aware of the business strategies that are focusing on those technological innovation. So this course or the collaboration that we were focusing on, we are actually focusing on the ABCDs. You know, we generally call in academy ABCDs. So A is for artificial intelligence, that we are already speaking about, right, discussing about, and B is for blockchain. So as Mr. Neeraj was already mentioning, the huge amount of data fragmentation, right, that is going on, and uh, uh, data transformation, right, transfer of data into different places and domain, the trust becomes a very really very big factor. And I think when technology evolves more, so with cloud database and a blockchain level of trust, if it can provide, so AI can be much more effective and much more you can say trustworthy, right? Also like earlier days we used to hear that there were some doctors like Dr. BC Roy and other doctors were there, so they could just look at the patient and they could diagnose that what is the disease they are having. So there are so many such examples and cases that are there. But now, we have a second brain with us, right? That second intelligence. So we are talking about co-intelligence, right? So where AI will give you suggestion, and the expert, the doctor, the healthcare expert, they can actually evaluate whether that suggestion is trustworthy or not, and then they can act on it. So you don't have to think in that term. The overall load of thinking, data management, and getting the information, that is not overall on the healthcare professional or the doctors, but you now have an assistant who is very well versed in remembering everything, remembering the histories and all, deciphering it with the machine learning tools that are there. And the only task that remains, that we are trying to bridge the gap, is if you are aware about the technologies, and if you are aware about how the assistant is working, you can actually better your skill sets. So if you know which machine learning model or tool or anything that is being used in the background, you will be more assured that whether we can rely on this information, whether we can use it for decision making and not. And what I have read already and heard from also some few of my friends who are in the medical field, early diagnosis is a very big, has a very big impact in reducing the mortality, right? So somewhere I read sepsis some kind has a 8% higher mortality every hour if it is not detected. Also we are partnering for different cancer diagnosis things. So you can actually now, with the technology that is there, with the patient records and other technology, you can actually detect early. And as Mr. Neeraj already informed, that you can actually help the patient know that you may be having such a case, and you are most welcome to get it treated early, so that you don't face when it is already late, in a very late stage of, and when it cannot be cured, and all the blame then comes on the doctor, that why you cannot save the patient. And that should not happen, because if you can diagnose it early, if you can read from the data, the records and everything, you can actually use data analytics and AI to support this journey and reduce the mortality is there. One more thing, so three aspects that AI or our we are trying to focus on is, first one is the clinical aspect that we already discussed. So clinically, the healthcare professionals are expert and they can work. So we are trying to imbibe the tools and technologies that are there, which can help them better, and what are the use cases that are coming up, so that more use cases can also be developed. Second is the operational efficiency that Dr. Rajiv and Mr. Neeraj already spoke about. That operational efficiency is very, very much important, with the efficient recording of the patient data and supporting the customer, and pre and post, right? So it is a whole 360-degree cycle, as Mr. Sinha already mentioned. So operational efficiency, and what we all have already in business that we know is this operational efficiency and a better clinical system will definitely convert into a good financials, right? So when the financials are better, when the players or the service providers in a well shape in financially and reduced cost, right, the facilities, the services are also going to improve, right? And it will also help the government, right, to come up with better policies and better claim management, right? Insurance is another field where this claim management comes in at a later stage, but it's a very really, it also contributes it into customer satisfaction. The better the claim management, they are more satisfied. So all those aspects we are trying to club into a course, right? And where academia alone cannot impart this knowledge, we definitely need the support of industry and healthcare professionals, and where Gravitas AI features in. And I'm thankful to Mr. Sinha and Mr. Ars and other partners who have readily agreed to the proposal, and they actually are now uh, driving it, that yes, this is very much important and we should focus on developing the next generation of AI ready, clinically knowledgeable, and tech savvy, right? The Gen Z or the next gen that is coming in, they are a lot tech savvy, and we
Gen
will find
Alpha.
Gen Alpha, yeah. So
Yeah.
Yeah.
as Mr. Neeraj was already speaking about Medicover, so now we find many doctors are actually using tabs and all those are connected. So once you go, you don't have to tell them the history. They already know. If you are a repeating patient, they already know the history and they will just diagnose, and it will reduce time. So waiting queue is also getting reduced. So we are trying to reduce that, bridge that skills gap, right, and make a more tech savvy population, digitally well equipped population, right, so that they can drive this transformation more effectively.
Yes, I was about to actually ask you about the core objective of that forthcoming certification for the digital transformation in healthcare. So you have actually already mentioned about the ABCDs of what you are going to develop and come up with the courses, making the students industry ready. So would you like to add more on that, like for my exact question, like objective of the upcoming certifications?
Yeah, so some one of the objective is that, and maybe because I am teaching finance and more specifically fintech. So what I have observed, that maybe healthcare and AI and other things are very much well required. And India has done a very good job in payments technology. So PayTech, now we know UPI and others are game changing, and the world all over is praising the initiatives that has been taken. But somewhere I feel that insurtech, is the new upcoming thing that needs to be well developed, and India can actually feature in that space, having big players in the insurance domain. So I think insurance is no more the thing of only claims management when it has already happened. It is actually can actually contribute into changing your behavior. So somewhere I read there are now policies coming up, insurance policies and all, that may help you reduce your premium if you are having a well behaved thing, right? You have connected devices, you have smartphones, rings, and what all things that you have, and all that data is getting fed into the cloud. And then maybe if you walk every day 10,000 steps, next time you will find your premium has been reduced. And if you are doing right, so anything that you want with your health, right, and you are doing some very rash things in your lifestyle, you are not changing your lifestyle, you may be penalized with your higher premium. So actually you can change the behavior, and that further adds to the healthcare domain, because a better behaved, right, well behaved patient may be very much thankful to the healthcare system, because they have been diagnosed, they have been treated with all this data. And maybe, as Mr. Neeraj already mentioned, with that kind of customer support facility, you can actually give rewards to your patients that yes, you are doing well, and you can actually win this race against the whatever disease that you are having, and that actually encourages and creates more connectivity. So we are actually focusing on that. Another challenge that Mr. Neeraj already mentioned and Mr. Rajiv also mentioned, the supervisory challenge, right? How to supervise all those things and everything. So supervisory challenge will also get reduced the more you adopt these technologies, and most of the supervisory, the customer facing jobs can be done in a much well mannered way, right? Well, in a better way, right? So you have a now again the next time you have a better customer. So always we try to bring in our customers back, and they should also refer you to other people so that it gives you much more revenue in that sector. So the core objective of this certification is not only making the people aware of the digital transformation, but driving it forward with whatever use cases that you can get, whatever new innovations that you can bring in, and how you can actually uh, become the next generation of people who are the tech savvy people and who are actually applying this thing. So we are talking about AI, blockchain, and machine learning for a long time now, but the awareness gap is still there, right? So people are aware that it can be detected, but maybe they are not visiting the places, or so we have to bring it to them at their home, so there where it can be detected and it can be pre early diagnosed, so that the things can be recovered in an early stage. So sir, Mr. Neeraj already said that now everything is paperless in Medicover, but somewhere I read with the generative AI and agentic AI, people are trying to develop applications that can read the handwriting of doctors. So there has been much debate on general people are
Correct.
unable to read it, but now you with AI, we are also trying to do that so that everything is recorded. So you don't have to manually record those information. Maybe AI agents can do it for you. They will record it, they will store it, and they will retrieve also whatever is required at the time. So I
Correct.
think generative AI is going to play a bigger role, and with the support of the Gravitas AI doing it for like natural language, right? So bringing in more language into it, more vernaculars into it, will actually make it much more scalable into very, let's say, regional levels. If you can scale it, it is going to be a game changer in the healthcare profession. So our objective is to bridge this industry and academia gap, and with the help of, definitely with the industry, we will not be able to do it alone. So we need the industry, and we will feature in as academia, and we'll try to develop these core skills in the next generation.
Great, great, Professor. You obviously being very humbly saying that you need the industry help, but I should say that it is very refreshing and it is so admirable that how you have articulated the entire, understanding. You are the people who are imparting knowledge and making the students ready for their future and making industry ready. But you have so much understanding about all these tech and how it is happening from the level of day-to-day life. You have beautifully articulated and made us understand how it has been used on a daily basis, especially in a very humorous way. So thank you for that. But I would like to know from the industry perspective, from the corporate perspective, through Dr. Rajiv, on his opinion from the industry perspective. So, sir, please tell us what's your opinion about the industry academia collaborations for effective AI innovation in the healthcare industry.
Yeah, so I completely agree with what Dr. Bandyopadhyay said, and in fact, we have been not only from a company perspective but also from a association perspective, whether it is through Association of Indian Medical Devices, whether it's IMED or FICI, or the other associations that we represent. We have been trying to see how we can bridge this gap of HR, which is human resources in this particular area. Not only in this particular area, but other areas too. I mean, earlier we were talking about in the medtech industry or healthcare industry, we don't have enough biomedical engineers. We don't have enough people who could understand the bridge between healthcare and metallurgy, because medical devices is more towards not more towards drugs, but more towards the understanding the particular substances and metals that are actually intricately looked into the patient anatomy. Now the other challenge, or now what we actually want to bridge the challenge is how smart and innovative digitalization can actually assist in product development, assist in smarter research R&D, because it reduces time to a larger extent when we try to develop a particular product. In the case of vaccines, in the case of maybe a medical device technology, anywhere between 5 years to 7 years to 10 years is largely the time taken to come up with a new age or a new device product. But how can this smart technology look at algorithms which could be converted into something that we could perceive for the next 10 years, that this is going to be the reactive substance, and possibly these are going to be the algorithm outcomes on patient centricity when we look at a newer product to be developed. So I think that is where such courses, such industry oriented courses can actually help us. We may not have time to immediately wait for the next 3 years or 4 years to actually have someone graduate to the level and join the industry. I was a part of this scale committee, which is standing committee on local value add and employment, which is a part of the government of India, Ministry of Commerce. We came out with the fact that 32 lakh employees or 32 lakh professionals are required by the Indian medical device industry alone by 2035, which means even if you take the broad figure of India at 2047, which is towards 100 years of India, we would require more than 2 crore people into the healthcare industry itself, with the kind of population that is growing, with the kind of specialization that is moving into it. And there is where we need more and more institutions to help us in these kind of specialized areas. Dr. Neeraj talked about cardiovascular care earlier. I mean, he was talking about how interventional cardiologists can actually look at how this could be done. Can there be a perspective course where we could look at how AI in cardiology could actually reduce patient uh, could reduce the product development cycle, could reduce possibly the entire research and development, so mainstreaming can actually have the implementation done much more faster. What is the kind of technical barriers that a cath lab can actually look at? What are the kind of technicians who could be quickly churned into cath lab heads or cath lab technicians who could understand how these technologies are going to be utilized or done? Take a classic example of during COVID itself. I mean, COVID, everyone was trying to look at how newer technologies, and especially when it was with regards to oxygen concentrators, were to be used. Unfortunately, 70% to 80% of the nursing staff, the technical staff, and even the frontline primary care doctors could not understand what and how to use these technologies. Today, if we look at the fact, yes, we require not only in one segment, but we require in multiple segments. So fortunately, as Mukesh ji knows, and even Dr. Lal will know, under medical devices, we've got implants, we've got diagnostics, we've got IVDs, we've got disposables, consumables. These are 8 sectoral areas that are under medical devices. And if there could be a specialized focus on these sectoral areas, maybe a bridge course, maybe something which could give us much quicker and much faster human resources, which could be dovetailed to the industry requirement. I want an IVD expert who could actually understand the diagnosis in an AI algorithm. I know I could go to this institute and I could actually pick up the postgraduate diploma folks, and these guys would have just the right set skills that I require. They would have a 1 year complete course curriculum that they would have gone through. They would have understood the entire dynamics of product development, and they would have also looked at how patient centricity and patient care could be leveraged through these AI technologies. So I think it's a very important conjecture. A lot of things are done, and as I said in my start itself, we need a new AI revolution, which is not possibly the digital revolution which India has already moved towards, we need more academia and industry revolution. So let's go back to the basics and let's try to get the right set of people within the industry.
Definitely, definitely. Actually, it is so great to see how it is, shaping towards a greater future, and how many probable doors and opportunities it opens to develop more courses. The more the technology evolves, more options for students to study and be industry ready and make the game changer in the future. So that's
Actually, if
so
you look
great.
at it, it's not only from a medtech perspective. Look at the pharmaceutical
Yes,
part itself. The
yes,
pharmaceutical is a much bigger brother than medical devices,
yes.
and even beyond medical devices, there is now assistive technologies that are being developed. Hospitals are using these smart robotic technologies. Hospital are today there's a lot of AT, which is assistive technologies, which is being ultimately utilized through AI algorithms that are connected to your veins, that are connected to your brain, and a particularly imputed person can actually look at living a normal lifestyle, a normal walking lifestyle, or a normal, um, not disadvantaged lifestyle just because of AI technologies. And this is how it is going to have an impact globally. The wars are actually going to create more and more disabled people. Just look at the kind of technologies, look at the kind of areas that require more and more human resources and professionals into it. So while I talked about maybe 32 lakh people by 2035, or maybe 2 crore people only in India by 2047 in the healthcare industry, which is combined between hospitals, pharmaceuticals, medical devices, IVDs, or assistive technologies, this is going to be a huge game changer globally.
Yes, yes, that is exactly what the Gravitas AI is striving to achieve and play a role with a sector agnostic approach, I believe. We talked a lot about the healthcare sector. So, which let's shift gears slightly and talk about finance sector. So, Professor, being a finance professor, so how do you see the role of AI in finance management of an organization? You've already talked about that, but I would like to know more an elaborated understanding of the role of AI in the finance management of any organization, because it is inevitable for every organization, be it any sector.
Definitely. So, as you have rightly said, so it is very much important for every organization to have the better ROI, right? So there are investors, there are promoters of all these institutes, and they are looking for not only to give the service but provide the service, but also looking for a better ROI from those investments that are being made on those sectors, right? And I think healthcare domain itself is a big business domain that generates a lots of revenue, but AI plays a very important role. So I was reading some report by McKinsey, right? So right now 55% of CFOs are using AI tools to better forecast. So one of the items is like a working capital. So healthcare domain is somewhere it's not like a manufacturing domain that there you can forecast very easily what is the day-to-day working capital requirement and everything. But here you can use AI to support you, right? What is the working capital requirement in your day-to-day business? Then you can forecast your revenue easily using the data that is available, and the forecast accuracy has been increasing day by day with the use of AI. So you know then that how much of investments have to be made to provide those services, to continue those services, and to better facilitate the customer, right? To reduce the customer churn that is maybe happening due to any reason, right? And the another big role is, as I have already spoken about, that the healthcare sector is facing right now, maybe in India, in any other countries also. That is the claim management, right? So if you can make it a better claim management support or claim support that you have, so most of when you approach any medical facility or hospital or healthcare, we say that your savings may go very low, right? So you may not be the savings may not suffice to help you recover from that, and insurances play a big role there to support you. So if you can support the claim management journey of the customer through better tools that can help them understand the language of the insurance, first of all, that what is provided, what is not provided, and what else do you need to cover yourself, how much you are covered, that will also help in better customer satisfaction. Another big role that I have seen while teaching, like say, fintech, is the regulatory environment. You know, more of multinational companies, right, in the healthcare system, or are coming in and featuring in different countries. So we have the hospital chains that are multi-country hospital chains, and as soon as you go into another domain, right, you have a different regulatory environment altogether. And regulatory environment is a big challenge. If you are not fulfilling the requirements of that regulatory domain, you may face penalties, and penalties may range to millions or billions, where you have failed to satisfy something. It may be satisfied in another region or country, but you are unable to do that, and that comes with their own legal expenses. It comes with its own dissatisfaction and reduced services, and ultimately inefficiency in the system. So RegTech is another domain. We have some companies or startups coming up who are designing AI. So they have created a regulatory genome, right? Like human genome we speak of in healthcare, there is a regulatory genome that can be mapped from one country to another, and it will help you transform your business readily. If you are good in providing a better healthcare facility, focus on that, and the regulatory changes you can leave it on AI. AI will try to map up your reporting system, your declarations, your data management, right? Everything according to the requirement of the next domain, right? So financial management is also going through a huge change. So if you talk about personal finance, also we are using AI tools and everything to rely on the investment decisions that we are going to make. And one more big area where AI is helping is risk management. You can actually foresee what is the risk, upcoming risk, and you can actually calculate the risk adjusted return that you can make. So now we are not only talking about return on your investments, but the risk adjusted one, what, how much amount of risk that you can simulate through AI, that what is going to be the domain of risk that is there, and how you can hedge yourself from that risk, right? How to hedge and how to overcome that risk. So huge way finance is getting evolved, and I think it is required also to provide better facilities in the business. One more domain is the fraud management, right? So that we all are facing in all business, irrespective of the domain. So fraud and uh, mis invoicing or billing issues and everything, that can also be managed through AI. So these are various domains how this finance is actually helping.
Thank you so much for sharing from that, which is very important to discuss about and to develop every, which is relevant to any industry vertical, in material of which sector it is, and finance management is part and inevitable in every sector. Coming back to the healthcare, I have the next question from Mr. Neeraj. Sir, we have talked about the challenges and the current practices, etc. I would like to see the future. So, how do you see AI transforming Indian healthcare in the next 5 years?
See, future of healthcare is very safe if we adopt these technologies. See, now you are a connected world. So you got around more than 30% of the patient coming from tier 2 and tier 3 cities in the big cities. So health, if you are not reaching to those cities, metros and big cities are choked. So they are dependent upon these cities. And if we use this technology, we can take the healthcare to tier 2 and tier 3 cities. And the hospital which is making use of these technologies, they are there. Otherwise, gradually, if you see, say, so many hospital which is on sale, which cannot able to do business. So now I think some people say, okay, healthcare is only available in big cities, but healthcare is not. But what I say, healthcare is there. Total number of beds are there. Everybody want to quote as per the WHO, the number of bed versus number of doctors. What I say, in India, number of beds are very much there, but it is not uniformly
10 minutes
scattered.
could have you.
So it is not uniformly scattered. So if it is uniformly scattered in tier 2 or tier 3 cities, I'm talking about virtual bed through these technologies. So if we can reach there, I think we can have able to have full control over healthcare. And I always say at the end of the day, healthcare is not, hospitals are moving away from the hospitals. Hospitals are only meant for OR and critical care. Rest healthcare is available at your doorstep. So that is the future of healthcare.
Thank you so much. Actually, Mr. Mukesh, I would like to hear your thoughts briefly on this.
I think we should be also mindful about the time. So when you have passionate speaker and equally engaging moderator, so this is what happened, right? It's already 1 hour
Yes.
plus, in fact, 1 hour 20 minutes. So I'll just put because in between I have disconnected. So we are working in the very dynamic field, right? Technology is also changing. What we were talking about. Industry 4.0, now 4.50 is already in. So from AI, artificial intelligence, now intelligent automation is there. So very much I think during the discussion we have talked about, like we have a good buddies, human buddy. Similarly, we are going to have a digital buddy with everyone, so that you can rely based on the richness of the data. And of course, ethical AI is very, very important. How to use data, this is very, very important. So it is a collective responsibilities of academia, industry, and the society to how to use these kind of technology for the betterment of the society, not for the individual or particular objective. So this is my the final thought about this session. And similarly, I think we can have just one or two kind of lines kind of there, and we can sum up this session. Because
Yes.
I'm getting some
Yes,
messages
fine
in
line.
private. In private, that we said close this one. We have the next session
Yes.
also planned, right?
Absolutely, absolutely. And I'm so sorry because, as you rightly mentioned, we have more insightful thoughts coming up from the great
Correct.
minds. And yes, we have so much to talk. But yeah, considering the time, we can wrap it up with brief and thoughts on this particular thing from other two people as well. So, Dr. Rajiv, and followed by Professor. So, your thoughts briefly
So
on this, please.
I'll actually sum it up as I said, and saying this third time since morning. Let's build a new AI, which is academy and industry relationships. And one thing that what Dr. Bandyopadhyay talked about is, why should we rely on a McKinsey report? Why can't we rely on Dr. Bandyopadhyay or institutions that we have in India who could be custodians of future healthcare professionals, who could be custodians of repositories of data, which could actually look into how AI can invest into a circular economy altogether.
Great, great.
Correct.
Yeah, I think, sir, yeah, please.
Yeah, so I'd conclude very briefly. I would say all the audiences and everyone, being from academia, I would just have a one-liner that learn it today, learn AI technologies today to lead tomorrow. So because tomorrow's leaders are going to be very much AI conversant. So if you are in that pathway, you can accelerate it by learning AI. So with that, I will conclude. And the future is there for you, waiting for you.
That's a great way to conclude this entire session, because getting the reassurance from the academic perspective. Thank you all the panelists today for the valuable insights. In fact, I should apologize for taking it too long because it was very engaging and informative and insightful. We hope this discussion showed how strong industry academia partnership can make AI strategies more practical, impactful, and effective, especially in sectors like healthcare, finance, and beyond. As you heard, IMI and Gravitas AI are working together to build real outcome driven AI solutions and talent development programs. So, this partnership aims to bridge the gap between research and real world deployment. So, organizations can implement AI strategies with confidence, the right guidance, and measurable ROI. So, we are excited about the doors this collaboration will open, like for students, for professionals, for businesses, ready to take the next step in their AI journey. Thank you so much For this is just a beginning. So thank you so much for being a part of this beginning, and please stay connected, everyone, on our socials. So stay tuned for more such insightful sessions. We'll be coming up with more webinars and talk sessions like this. Thank you so much.
Thank you very much. Thank you. Thank
Thank
you.
Thank you.
you.
Thank you,
Thank
Dr.
you.
Pal.
Thank you all.
Thank you, Dr. Bandyopadhyay. Mukesh, thanks a
Thank you.
lot. And great
Thanks,
having a
everyone.
conversation today. Thank you.
Thank you, everyone. Thank you.
Thank you. Thank you, everyone.